Are you considering breast augmentation? Well, before you make that decision, some things have changed, allowing you to have more options. I want you to meet Dr. Deborah White. She is a plastic surgeon in Scottsdale and is here to show us the very latest in implants. And who knew that things have come so far, Dr. White? First of all, welcome to Sonora Living.
Well, thank you for having me.
Excited to have you here. Why do you like doing breast augmentation so much?
Well, first of all, it's really rewarding to be able to help women feel more confident and comfortable with their appearance, both personally and professionally. And with breast augmentation, we can help them achieve better symmetry, maybe better proportion, and help repair issues that come from things like pregnancy, weight loss, or even just aging.
Right, because it all changes after a while, doesn't it?
Yeah.
All right, let's talk about how far it's come, and just even the last probably 10 to 12 years. But what is it about implants that's really revolutionary today as compared to a while ago?
Well, I've been doing breast augmentation for at least 25 years, so I've seen a lot of fads come and go. And there's definitely newer techniques that are good, but I think one of the most crucial things is we have better tools to work with now, like you were talking about. In the old days, you pretty much just had one style. It was kind of this pancake style. And it's flat and it's wide. And for a lot of people, this wouldn't fit on their chest.
Yeah, it's a lot longer across than this one. Why is that?
Well, so now you can have the same volume with a different base width, and they come in a gradation. So this is like a higher profile. So someone with a narrower chest can have the same volume.
Ah, I mean, you can clearly see the difference between these two. It's all on body style now. What is this one here? What is different?
That's what we call a shaped or anatomic implant. And you can see they come in, this one is wider than it is tall. And you can get taller than they are wide. And particularly for breast reconstruction, these are very important.
Ah, and here's what's revolutionary as well, is it always used to be saline, but look, this is not saline anymore. What is inside of this implant?
And it's silicone gel, but it's not your father's gel, as you could say, I guess. The old gel is very liquid, and so people were concerned if they ruptured, it could get outside into the breast tissue, which is messy, even if it's not dangerous.
Right.
So these newer ones, they're more cohesive, and so even if it ruptures, you can see it just sits there.
Yeah.
But that also contributes to things like lower rupture rates and better safety.
I want to take a look at some of your patients that come to see you and some before and after pictures. And you clearly, I mean, we're not here for show. It's really for proportion is what I'm seeing here.
Absolutely, and hopefully the days of the breast the size of your head are gone, because those aren't very durable. It stretches everything out. But what we're trying to do is get a natural look and showing these women with these different body types with these different implants in place, showing that you can have a nice result.
Absolutely, absolutely. What is the most important piece of advice that you could give a woman who is considering breast implants?
Well, you definitely want to make sure you go to someone who's experienced and I'd say board certified in plastic surgery, because in the US it's totally legal to have no training whatsoever and do any kind of surgery you want in your office. You can be a GP, take a weekend course, and do breast augmentation.
Wow, so ask a lot of questions.
Yes.
Look up credentials. How long have you been here in the Valley?
Over 20 years.
20 years.
Yeah.
A lot of breasts in 20 years.
Definitely. And you also want to go to someone who's going to really listen to you and has enough experience to know what your options are, and be able to tell you what you need to hear, not necessarily what you want to hear, but to make sure that you're going to make a choice that's going to give you joy for years and not cause problems. Absolutely.
That's the last thing anybody wants, and it's all about that very, very important consultation. So let me give you Dr. White's information. Dr. Deborah White, she is located at 8896 East Becker Lane, that's Suite 104. That's near Shea and the 101 in Scottsdale. Here's that phone number to call to set up an appointment, 480-614-3535. To learn more, visit drwhiteplasticsurgery.com.